Often patients come to my clinic and say that Dr. Botox and fillers cause so many long-term effects, so many long-term side effects. Well, absolutely myth. That's not a fact at all. These have been there for over 15 to 20 years now, and there is more than enough safety profile which has been established around them. And of course, they are CE approved, European Union approved, and they are FDA approved, whether it is Indian FDA or US FDA. So we know that there is not much of long-term side effects when we're using these injectables. Now let's talk about Botox. The origin of Botox actually came when it was used for spasms, to treat spasms, which is a medical condition. But now it is used to relax the muscle, which cause excess of contraction and hence cause lines of aging. So Botox typically is destroyed or it goes away from the body in 4 to 6 months. It does not stay beyond that. So hence Botox can never cause any long-term damage or permanent side effects. If a Botox goes into a wrong muscle, which you have done through a bad injector or somebody who's not experienced, even in that case, you will have the temporary loss of action of that particular muscle, muscle action, which may have consequences, but it will only last for 3 to 4 months maximum. So there is no long-term complications or problems with Botox. Now let's talk about fillers. Fillers are actually made of hyaluronic acid, which is anyways present in the normal skin. Most of our cosmetic products also contain HA. It does not react with the body, it's biocompatible with the body, it has no side effects, it has no allergies, and it just merges into the body. So how can it cause any kind of side effects? Well, most of the problems come with fillers, with poor injectors, or with people who don't understand how a product works. For example, if I have a hard HA, and if I inject it in the lips, it will feel very rubbery and tight. I have to inject it deep. It's for structure and replacement of bone mass. Similarly, if I use a soft product for causing lifting, it will not give me any results. And I will end up putting excess of product where the face looks bigger. Hence, those problems are more injector driven or not understanding the product driven problems rather than them being the problem because of the injection itself. Most complications occur not because the product is unsafe, but because the way it is injected or the manner in which it is used makes it unsafe. So going to a proper board certified plastic surgeon or a dermatologist or somebody who's very qualified in order to do these procedures will always ensure safety. Somebody who's very well trained in it, somebody who knows and understands the product, who's got number of years of experience, actually somebody who trains other doctors also, has to be somebody who's much more experienced as compared to other surgeons or doctors. So hence choose your doctor wisely when you go in for these injectable procedures. Do not blame the injectable, do not blame the material without understanding the consequences, that if a side effect happened, why did it happen? Did it happen because they went to a parlor? Did it happen because they went to an unqualified doctor? Did it happen because they did not understand the product or got something wrong done with it? So do not blame the product if the problem is with the injector or not understanding the product. Hence, always choose somebody who's wise enough to understand the product, who's used it enough number of times, and who's of course board certified, who's qualified to inject you. And the other good part about a qualified injector is if there is a problem, he knows immediately how to treat it, how to reverse it, and make sure that it does not leave any harm or any other damage to your body. And that is why you need to go to somebody who's experienced here. So always go by evidence-based or science-based information rather than hearsay.